And I will, oh, I should go to this first. And are we recording?
Yes.
Thank you. All right.
Admit.
I can admit them. Admit all. Can you take over the admittance if they show up? Because Assalamu alaikum, everyone. Apologies for the delay as we were setting up. Just to let everyone know, please stay on mute and keep your videos off during this meeting. And with that, let me put this in presentation mode and I'll hand it off to Zain to get things started first.
Yeah, welcome to our Congressional Training 2.1 or 2.0 training, taking healthcare advocacy to the next level. So my name is Zain. I'm with Poligon.
So Zain, we are losing you.
Uh-oh.
Okay, so as Zain is looking to fix her connection problems, unfortunately, she was having some issues. Let me introduce myself, and the next few minutes I will take care of things. And so my name is Sana Sayed. I am a neurologist in Boston and the Health Policy and Advocacy Director for American Muslim Health Professionals. We've been collaborating with Poligon to have a series of advocacy trainings that have a focus on healthcare and public health. This was an initiative that was started owing to the pandemic and the sudden needs at that time. And we're going to continue these efforts hopefully long after, because I think the pandemic showed us that we need to be prepared before the problem starts as opposed to once the problem is in full swing. So just to give you an overview, So just to give you an overview of the efforts that we've made since the pandemic started, and this is just an example to show you what it means to do community organizing and the impact of such organizing in the long run. So as some of you, especially the ones that attended the first training that we pulled together, when the pandemic started, we put together a National Muslim Task Force specifically focused on COVID-19. And within that task force, we also had a policy committee. And both Poligon, which Zain belongs to and is having some technical difficulties, and myself, I belong to American Muslim Health Professionals, we both are a part of this overall task force, and specifically in the policy committee. The overall task force has more than 40 organizations, and we just bring together an array of public health and medical professionals. We have even faith leaders and advocacy experts and social justice experts. And the reason that is important is that because of all of this sort of comprehensive expertise, we were able to have a very good response to the needs of not just American Muslims, even though it says that here, but Americans in general, because we have focused on policy issues that impact everyone. Increased testing is not requested by saying, oh, we need increased testing in my neighborhood where only certain people live. It's everybody. So that is what we've been working on. We've had mask making campaigns. We've had humanitarian drives for food and money and what have you. And today we're just going to focus on the policy committee, however, which focuses on public health legislation mostly related to PPE, testing, food insecurity, which rising as it may be, is still a public health issue. And these are legislative processes that impact everyone that lives here, basically. So just to give you an overview of what the policy committee in general has done, this is the advocacy framework that we have utilized to move things along. We've sent letters, we've done in-person meetings, we've done petitions and action alerts, and then these are the trainings in the middle, and we've done advocacy training with very small groups as well. And this is just to show you what advocacy consists of and how we're going to go through some elements of this advocacy framework today as well. In the process, we've also partnered with different organizations, because I'm telling you, advocacy is all a game of numbers. And I mentioned that we had different faith-based organizations. There's obviously some interfaith efforts as well going on. And then at the same time, we're also collaborating with a number of other public health and healthcare organizations and various academic institutions as well. So let me pause for a second to see if Zain, you are able to speak now, and if everything is better now.
Yeah, do I sound better now?
Oh, excellent. Yes, please.
Okay, great. Sorry about that.
Just on time.
Okay, perfect. And once again, my name is Zain. I'm with Poligon, and I'm their legislative fellow. So I'm going to go ahead and just jump right into this and start off with saying constituent advocacy works. Time and time again, we have seen that professional and local and direct constituent grassroots advocacy with members of Congress and staff have been proven to be effective. And so why does this work? Because they need to appeal to be reelected. We know that the Senate serves for 6 years and the House serves for 2 years. And this is a critical election year where all the House members are up for re-election and some senators as well. And like I mentioned, your representative represents you. So if they're not representing policies that you and your community are asking for, they're at risk of losing your vote. And so a recent example is with some work that our policy committee has been doing, and I'll let Sana go into that.
Yeah, so thank you, Zain. So what Zain is referring to is the in-Senate meetings that in-person meetings with senators that I alluded to earlier in the graphic that I showed you. So what we did was, through the coalition, we set up meetings with different senators in certain key states where we thought that A, COVID was in full swing, B, we thought there was a need for a legislative push in the right direction. The right direction is not which side of the Republican or Democratic aisle you're on. It's the side that leads to better public health measures. So it was a very bipartisan effort, and we focused on 2 or 3 legislatures. The TRACE Act, which is for increased testing, and also on food insecurity, and in some cases also telemedicine, because a number of us are physicians and there was an interest to move in that direction. And one of our healthcare partners, Women Neurologist Group, was also interested in the telemedicine angle. So what we did was, when we set up meetings with Maryland, with Ohio, with Pennsylvania, with Arizona, what we did was we made sure that at every single one of those meetings, we had a constituent member who had a healthcare background, and in most cases that ended up being physicians, present at that meeting to make the case for the need of that particular legislation, and with examples. So that has a very strong impact, because what they walk away with is that real personal experience from the ground, from people that live in their state, just like what Zain said, that they depend on you to tell them what is going on and what you need, because they need your votes. So this is, and it's not like they're leeching off of you or anything, but this is how it works. This is like a very consensual type of relationship where they need you and you need them, and this is the way to help each other, more or less. So that was the example that we had very recently, and these meetings are still ongoing, by the way. And with that, I'll hand it back to Zain.
Great. Yeah, and just an example, back in 2017, while the GOP was trying to replace Obamacare with a Republican healthcare, Senator Jerry Moran held a town hall with about 300 constituents that attended, and he heard their concerns about the Republican healthcare bill, and the two senators from Republican decided not to support the GOP Senate healthcare bill as a replacement and to repeal the Affordable Care Act. So that leads us to three names that you should know, which is your two senators and your House representative. And these are people that you want to have their contact information with their office for policies that you want to advocate for. And so here are some resources to help you find out who your representatives are. It's easy to find your representatives by simply entering your zip code on the house.gov and senate.gov website. And you can also use the Capitol switchboard number, and they will direct you to the representative's office. And for local and Senate offices, or local and state offices, be sure to contact them for the specific issues that relate to state and local issues. And so now that you've contacted your member of Congress, now what? So first, follow up. It's always important to follow up by sending emails and calling again. Next is to be sure to track the bill that you're advocating for. It's important to know where the bill is, and so we'll be going into detail about that more. And congressional recesses are a great time to contact your representative. So Congress goes on long recesses during holiday periods to work on, to do work in their home districts. So this is a great opportunity to reach out to offices and schedule an appointment to discuss issues that matter to you. So Congress is currently in recess, and they'll be returning back in September 7th, although the House has recently extended theirs. A great way to check on when Congress goes on recess is to go directly on the House and Senate website and find their legislative calendars. And you'll also be able to see announcements on the House and Senate majority leaders website. And so they'll announce when the chambers go into session or when they're on recess. And during the pandemic and due to social distancing, a lot of offices will be holding virtual town halls and virtual meetings and phone calls with their constituents. And be sure to follow up. So send a thank you email once you do contact them, summary email once you've reached out to them, and don't be afraid to send them multiple emails if they haven't responded back. And so now we're going to go into tracking bills and why this is an important part of advocacy. So you want to know what the status of the issue you're advocating for and where it is in Congress. So here we'll go through the process of passing a bill. So when a bill is introduced, it will be sent to different committees for markup. These committees will then either vote to advance the bill or to kill it in committee. This is also a chance for representatives and senators to add amendments to the bill. And then it will if the bill has been voted through the committee, then it will be voted in the House and the Senate. And this is the last minute chance for senators and House representatives to add amendments to the bill. And then once it passes both chambers, it goes to the president for a signature. And so co-sponsors, especially bipartisan ones, are really important here. And Congress can also have the ability to override a bill or a veto that the president, a bill that the president vetoes with a 2/3 vote in both chambers. This is rare. Historically, Congress has overridden very few bills with 10% of all presidential vetoes. And so committees are really important because this is where the bill gets discussed and often amended. So there are members that are the subject matter expertise on these bills, therefore getting their support is really important. Bills can go to one committee or multiple committees. So here we can see the House committees. And then here are the Senate committees. Oftentimes for healthcare bills, you'll see them in the Health, Education, and Labor and Pensions Committee. You'll also see them in the Appropriations Committee for bills that have to fund government departments such as HHS. And then there are also joint committees where there will be House and Senate members. So now we'll be talking about tracking specific bills. So here, using congress.gov, you can track any bill in Congress. It will let you know the bill number, how many co-sponsors the bill has, the status of the bill, and if it's in the House or the Senate, or if it's being reviewed in a committee. So this is a really great way for you to monitor the bill that you are tracking. So here's an example of the TRACE Act, which was recently introduced by Bobby Rush. And Sana, do you want to briefly explain this bill?
Sure. So thank you, Zane. I mentioned this in passing when I was describing our Senate meetings. So essentially what the TRACE Act is about, it's about COVID-19 testing, reaching, and contact tracing. And when it refers to contact tracing, this is more to ensure that everybody who's been in contact with an individual is aware that they are at risk and need to get tested, and the identity of the person is not disclosed. So it's not like they attach a device to you and then they follow you around or something like that, because there were some confusion around this. One thing that was unique about this bill, and isn't necessarily explicitly stated in our description here, is that there was a focus on underserved minorities. So they were allocating $100 billion, and they were focusing on those minority populations that we have now seen have been impacted more by COVID and have not had, historically not had, resources to address even regular healthcare, I would say. And now they had a pandemic on their hands. So the dispensing of these mobile health units is especially critical for populations like that, because at times they would have to travel a distance to reach a healthcare facility, right? So there goes your testing. And in the process, while they're taking public transportation to get testing for the fact that they may be infected, they may expose a number of people, not because they want to, because they don't have a choice. So this caveat for funding for mobile health units was especially critical, and it seemed to actually allocate funds to a need that was identified during this pandemic. So it's more a matter of equity in resources, because a lot of times what happens in certain communities are underfunded to begin with. And when they reach a position where they're put under extreme duress because of the pandemic, for instance, in this case, they're not able to catch up. So this was a bill that we were supporting, and we've had meetings with the various senators related to this TRACE Act, and we're still continuing. We'll also have a congressional plan as well to talk to various Congress folks as well. So with that, I can give it back to you, Zane.
Great, thank you. Yeah, and so looking at the TRACE Act, for example, when you're on congress.gov, there are various tools that you can use to your advantage. So for example, the tracker itself on the website, you can see that the TRACE Act has just been introduced, and that it has been referred to the Committee of Energy and Commerce in the House. And so another useful thing to note is that how many co-sponsors the bill has. And so right now the TRACE Act has 67 co-sponsors. So if your representative isn't supporting this bill, then this is a great opportunity for you to call your representative's office and urge them to support this bill. Another thing is you can see that there are committee activities. There's a tab you can click for that. You can also read the bill text itself on the website. So this is a great way for people to track the bills that they're advocating for. And since we are talking about the Trace Act, the National Muslim Task Force Policy Committee has created an action alert for this bill in specific. So Sana, if you want to mention anything about the bill and this action alert, and I'll link the action alert directly in the chat.
Sure, thanks, Thing. So a part of our advocacy strategy was to provide a platform for folks that are in touch with us or on our listservs or otherwise through our partner organizations to engage in the advocacy efforts that we were doing. So if we send a letter on increased testing with different partner organizations, which we did, it's also important to engage the constituents. So one element of that was the Senate meetings we had in which we had constituents present, right? So that's very interactive. But then, of course, that opportunity cannot be extended to every single person, and every single person has something to say. So these action alerts is a means of reaching a wider audience. So what we did, and if you click on the action alert that Zane posted, you will see that it will take you to a page where it will allow you to send a letter to your representative, an email letter. Nobody sends letters anymore, right? So it would allow you to send an email to your representatives saying that you are also concerned about the lack of testing, and you would also like there to be increased testing. And this will keep them updated on the needs of their community, right? So this is the whole reason that advocacy requires numbers. So all of you taking part in this action will highlight the needs that are present in your community. So this is one very effective way. There's also on that same action alert, you can also tweet to your representatives. And there's always a phone call option as well. But what we have seen in the past couple of months since I have really started doing this in full swing is that not a whole lot of people like calling. Because it's easier to email and everybody tweets these days. And if there was a text message option, I think they would go for that rather than calling someone, which is fine. But it is really important to engage and take action. And this is just one of the examples we had. We had another one on PPE as well, and we're trying to build out another one for the Trace Act specifically, which is also related to texting. So it's still relevant, and this is still relevant as well. So this is a good way to engage and actually be an advocate from the comfort of your home, more or less, without even like saying a word, more or less. So with that, I'll give it back to you, Zane.
Great. And another tool, which I'll link in the description, is a lot of nonprofits, including Poligon. We create August Recess toolkits or toolkits in general that help you give you tools on how to contact your representative and some topics that might be of interest. So here's just some screenshots from the toolkit. It gives you guides on how to attend town halls and how to set up an appointment with your representative. And then here are 2 example action alerts that we've included. And so I know Sana mentioned nobody likes to call anymore, but we've added a phone script. But you can always email your representatives and, send action alerts like the one that Sana mentioned earlier. And these are great resources when you don't know exactly what to say during a call or to write in an email. And so lastly, this is a great opportunity to build coalitions. If there is a topic that you feel is really important, find people and an organization to work with. So often it often starts organically in a response to a problem. And for example, the National Muslim Task Force formed over the concern for our faith community and COVID-19, and Sana can better explain that.
So yes, thank you, Zain. So yes, exactly. The National Muslim Task Force was created out of this need. Initially, it was just like, as we have seen in other faiths, that there is a need for practicing your faith, and we wanted to ensure that faith leaders are fully informed about the public health risk. This was the reason that it was so cross-functional. And it worked very well because we had the right people at the table. We were talking to each other very freely, and we created guidelines that allowed us to to guide the people that they should not be going to mosques in hordes, or even going to the mosque, especially in the beginning, because there was a risk to people's lives, and that is usually a core part of everyone's faith. So it was not to stop people from being whatever faith they were practicing, but it was more to allow them to fully appreciate the extent of the problem that they were facing, and how that they have to factor in all parts of their faith practices and be realistic about what was happening right now. And similarly, there are a few other task forces that have come into being during this pandemic. We've listed a few over here, but one that I will mention is the Physicians for Human Rights Coalition as well. American Muslim Health Professionals is a part of that coalition as well. And it's a very loosely formed coalition, because what happens during these coalitions is you discuss what you're doing as part of your own organization, and you come up with ideas that you share with each other, because advocacy is more about collaboration than competition. So this coalition with Physicians for Human Rights, we have Doctors for America in the table, we have AMA, we have the Nurses Union as well. And what we all know for sure is that we're looking for solutions for the pandemic, and that we are concerned when when the issues creep up that put like physicians or other healthcare workers, nurses, and respiratory therapists and others at risk. We are coming together to think about solutions. We are coming together to think about, these are the leaders that we need to reach out to and tell them that we, as all of these organizations, are concerned about these things. For instance, there was a problem in the beginning about occupational standards at work for healthcare workers. There was no clear guideline. The standards in the US were lower than the international standards. So all of these things, they require a group voice and a single voice, and that has a really powerful impact on the policymakers' decisions. And they're able to, well, they can be guided by it, and they can also be influenced by it, which I think is equally important. So with that, I can hand it back to you, Zain.
Thank you. Yeah, and that's a really good point. That, and also lastly, like, you know, advocacy doesn't need to be competitive. We can all work together and help with this. So, you know, now that we have all these resources at our hands, we can get bills passed. So some questions to consider is, who's the champion for your bill? Who are the leaders that you want to have this bill passed? Is the bill bipartisan? What committee will the bill go through? Where is it being referred? And who's in your coalition? Who are you working with to get this bill passed? And what's the process? Understanding the process of how a bill is passed is crucial to advocacy. I think with that, we'll wrap things up and take any questions. So if you have any questions, feel free to type them in the chat.
I'll just open the chat. And maybe Zain, you can track on the chat what is going on in terms of questions.
Yes.
Can stop sharing for a second. I don't know if folks can unmute themselves as well if you want to speak to your question, because you are allowed to unmute yourself, I believe.
And if there's no questions, I guess a small thing is just, continue to follow our work. Both Polygon and AMP are doing great work. And if you do have any questions, I can link our email below. Yeah, and thank you all for joining. Oh, Sana, if you're talking, you're muted.
Oh, sorry. Thank you. Thank you everyone for joining as well. And apologies for the initial technical difficulties. I hope you found this useful. We'll also be sharing a recording with everyone in case, especially for those who may not have been able to join on time or were not able to join, period. So thank you. And with that, we can close.
Yeah, thank you.
Okay.